Okay. All right. Well, thank you all for joining us for today's virtual session featuring a dentist, which I am really excited to have a really great alum here with us today. My name is April Chanel, and I'm one of the pre-health advisors at the Career Center. There are also pre-health advisors in the college office. And today our focus is on dentistry. And we have Adam here to speak with us today. And in terms of the format, what it's going to look like is that I've given Adam some questions, and he will be addressing those questions as well as throwing any additional things in that he would like to share and that he thinks would be important. And then we'll move on to Q&A. Does that format still work for you, Adam?
Yep.
Okay, well, I'm going to turn it over to you to introduce yourself and go through the questions.
All right, so I'm going to start by just talking about my journey, how I ended up in dentistry, and then I'll talk to you about dental school and my experiences there, and then about dentistry as a profession. So I'm from Downingtown, Pennsylvania, just outside Philadelphia, and I came to St. Louis to go to WashU for undergrad, where I was a major in biology and a minor in anthropology. And then when I was an undergrad, I did a ton of research. Summer after freshman year, I went to Joslin Diabetes Center up in Boston, up at Harvard. And then as an undergrad, I did 4 semesters of Bio 500. And then I also did the summer research program through the HHMI fellowship at WashU in the Department of Endocrinology and Lipid Metabolism. And I looked at how diabetes affects the brain. So through all my undergraduate experiences, I really wanted to pursue a career in research. So I entered a PhD program at the University of Michigan in molecular and integrative physiology. And I looked at different adipose signaling in diabetes. And about a little over 3 years passed, I actually got really sick. I have Crohn's disease and I needed to have a big surgery. And also my project, my main thesis hit a roadblock. I had negative data. So I was told I need to start over basically with my project. So at that point I was a little burnt out and I was looking for another direction. I was looking for something else to do. So I looked into different options and my dad recommended, why don't you look into dentistry? It's great. You get a lot of the physiology, good lifestyle, get to use your hands. So I met with some people at the dental school in Ann Arbor. And when I started looking into it, like it checked off every box that I was looking for. You got, like I said, better lifestyle. There's no overnights at a hospital, little to few no weekends. And then also you get a lot of the physiology that I like, which was my grad program. So you get that in the classroom work. And then you get to really use your hands. My research, I did a lot of procedures on mice and rats, putting cannulas in the carotid arteries and jugular veins of mice, rats, and also putting cannulas in specific parts of the brain and having them survive. So I love doing those little surgeries, suturing, and dentistry lets you do that pretty often. You get to use your hands every day. So I looked into it and I did a lot of shadowing because I didn't know anything about dentistry also. I was like, oh, don't you just clean teeth? But when I was shadowing, I learned that there's a lot more to dentistry that we're going to talk about in a little bit. So I left my program. Luckily, where I was in my program, in my PhD, I already did my prelim exam, which is the scariest thing in my life. You did a departmental seminar, then you're locked in a room with 5 professors for like 3 hours with a whiteboard and a marker. But luckily, I passed that, so I left with a master's degree. Then I enrolled in the Missouri School of Dentistry and Oral Health here in Missouri. So I came back, my fiance, my now wife, was here in St. Louis. So I came back, I was a part of the first class of that dental school. First 2 years were in Kirksville, Missouri. And then our clinical years 3 and 4 were in St. Louis. And part of 4th year is spent rotating at sites around the state. So I graduated in 2017. And since that time, I've worked as a general dentist at Premier Dental Partners, Old Ballas, which is in Creve Coeur. If you're not from Missouri, it's 15 minutes from campus in West County. So I work in a group with 3 other dentists and 7 hygienists. And let's see, I live in Maplewood, like 5 minutes from campus. With my wife, and I have 2 daughters. One's 4 weeks old and one's 2.5. So I thought I was coming just for undergrad at WashU, and I was going to go home to Pennsylvania where my family is, but ended up staying, so that could happen to you guys as well. So let's talk about dental school. So I'm sure you guys are all aware of the different prerequisites and the courses. And the dental admissions exam, just one thing to bring your attention to, make sure it has a special section called perceptual ability or visual spatial. So it's really unique testing. Just really make sure you do practice exams to really go over that. It's a different way of thinking, what they want you to do. And then in terms of shadowing, I know right now a lot of people aren't doing shadowing, but make sure you talk to dentists, different specialties, different dentists, and just learn more about the profession to make sure it's something you're really interested in. So in dental school, the first 2 years are really nonstop. I've seen stuff presented a different way, but first 2 years, you have a lot of coursework. So you have your basic sciences, like your cell biology, biochemistry, genetics, microbiology, and then you do your systems. So even though dentistry is just the mouth, there's medications we do and different things that can affect the mouth. So we still do all the systems. We still do nervous system, immunology, cardiopulmonary, GI, reproductive, urinary. And then for each system, we do histology, pathology, embryology, and then we also do cadaver work. So we do cadaver for all the systems, but at least my school, we didn't dissect. We only dissected the head and neck. For the other areas, the med students dissected, and then we went and identified the different structures, and part of our exam was to identify them for all the systems. But of course, the heavy emphasis on the head and neck dissections that we did. So in addition to that, you then do your dental specific classes, dental anatomy, operative, dental materials, occlusion, and you go through all the specialties. So you have endo, root canal course, pediatric course, oral pathology, oral radiology, anesthesia, patient management and behavior, and of course, a lot of pharmacology classes. The real meat of the dental curriculum, though, starts the end of first year. You start your simulation clinic. So what a simulation clinic is, each student gets a mannequin, and then you get to type it on. So you have you're given sets of fake teeth, and this is where you learn to drill all of your cavity, crowns, your bridges. And so each student, you have a mannequin with a setup with all the equipment that you'd find in a normal dental operatory. And that's where you really learn dentistry. So what's interesting about it, normally you're used to taking tests, written tests, but you're tested on your hand skills. So you'll have daily assignments that you get done. Then you have an exam where it's a time test to do a certain filling, a certain restoration, and get graded on that work. And then, so that continues at the end of your first year and your second year. And then your second year, you also have the joy of working on each other. So you start doing cleanings on each other, exams on each other. And then the really fun day is the anesthesia day when you start injecting each other. So what'll happen is you come in and you do half the face at a time. So you work with your partner and do like 6-7 injections just on one side of the face. So that's how you start getting your experience, which is kind of a fun day. Everybody comes out all droopy, looking like a stroke patient. So then that's really your pre-clinic. Then at the end of your second year, before you're allowed to work on patients, you will have competency exams. So rather than getting scored, you're going to have to do fillings or crowns or bridge. And basically, it's just a pass-fail. Pass meaning it's clinically acceptable. Fail meaning it's clinically not acceptable, and you have to do remediation. So that's kind of the check mark you need before you move on to the clinic and actually start working on people. So then that takes us to our third and fourth year of dental school, where it's almost entirely just all patient clinic work. You will have a couple courses and seminars, but again, it's the vast majority is going to be just working on patients and going through rotations. So you have your home rotation where you do like general dentistry, fillings, crowns, and then you rotate through the specialties to get experience with pediatrics, root canals, and oral surgery. So the way third and fourth year work is that you have to do X number of procedures to graduate. So you have to do 10 crowns. And then once you reach that number, you're ready to get graded for a competency. So you'll get graded by 2 instructors on your next patient. So that's how you get your grades your 3rd and 4th year. And so the clinic, you start with a big number of 2 patients per day,
Grab
1 in the
mouse.
morning, 1 in the afternoon, and then you work your way up for 4 patients, 2 in the morning and 2 in the afternoon. And it's a lot of hurry up and wait because you have to get signed off on every little detail. So you sit the patient down, your faculty member has to come over and check the patient, make sure the health history is good, the blood pressure is good, and make sure the procedure is indicated that you want to do. And then if you're doing a filling, let's say, the instructor you then have to wait for the instructor to come again after you prepare the filling. You then fill it up, and the instructor has to come and do a final check. So it's a lot of waiting around. That's a lot of the time involved. That's why you can only really do 1 patient or 2 patients per session. Okay. So then, as part of your 4th year, you're also getting ready for boards. So the written boards used to be part 1 and part 2, just like med school. You take part 1 after your 1st or during your 2nd year, and then you take part 2 sometime during your 4th year. But starting 2021, it just came out with the new combined test, the American Dental Association. So instead of part 1 and part 2, you're just going to have 1 combined test for everything.
Okay.
1 for the basic sciences and 1.
If
So you have
we
basic
want
sciences
to go,
and dental
like the
stuff
family,
on
and
both
when they're
boards.
not going, is when we can go. Me with family. Sorry.
So then also as part of,
Mary,
Mhm.
I may not be pronouncing your name correctly. Would you mind turning your, thank you. Couldn't even get the words out. Okay, go ahead, Adam.
thank you. Also, so you have your board exam that takes place over a couple days, but they're going to combine it starting 2021, so it's all 1 test. But then what's interesting about dentistry, you have your regional licensing exams. So you need to really have an idea of where you want to practice when you graduate, because these licensing exams are region specific. For example, I took the REB, the Western Regional Exam. So that's only accepted, it's accepted in a lot of states, but not all of them. Like Florida, you need to take your own, they have their own exam. I think New York is a unique one also. So you need to know which exam to take. There's REB, there's NERB, there's a bunch of different ones, but they're all fairly similar in that you're gonna have to do some work on patients, you're gonna have to do some work on typodonts or extracted teeth. So I'm just gonna walk you through what my licensing exam was for the REB. We had to do 2 fillings. They could be on the same patient or they could be on different patients, but they were a specific kind of filling. They wanted either a class 2 filling or a class 3 filling, just the types of surfaces. So you had to do 2 fillings on patients and you get graded on it. It's blind grading. You have to wait in line and there's like 3 or 4 people grade it. So 2 fillings on patients. 1 patient, we had to do a deep cleaning, cut scaling and root planing. Then we had to do 2 root canals on extracted teeth. 1 was on a front tooth, 1 was on a molar. And you took the extracted tooth and there's a way to mount it in the typodont, so it kind of mimics working in the mouth. And then, so that was the clinical part of my exam. Other ones, and you need to do a crown or a bridge on a typodont. There's a lot of variation. And then there's also a written portion, which you take at one of the prometric testing centers. It's basically about treatment planning and pharmacology and what steps would you do for certain things. So that's the licensing exam. So a lot of stress in that 4th year is finding the right patients that are trustworthy, that'll come in, and also finding the right patient with the right kind of cavity is the big thing. So you end up having to bribe the patients. I had gift cards, and you have to have a backup patient too, because you don't want to, your patient doesn't show, you don't pass, then you don't want to pay to take that exam again. So that's really the dental school curriculum as an overview. So then once you graduate, there's a couple, there we go. So when you graduate dental school, there's a bunch of dental specialties. There's 10 that are recognized by the American Dental Association. I have the list here, I don't want to forget it. So there's oral surgery, which is extractions, biopsies. They do a lot of neat stuff, but those programs are 4 to 6 years after you graduate. The 6-year programs, you do get your MD. Also, you actually go to medical school, but that's a long road. Then there's endodontics, which is root canals, and they also do a type of microsurgery called an apicoectomy. Periodontics, which deals with gum disease, gum grafting, gum flaps, implants. Pedodontics, which is all pediatrics. Prosthodontics, which is involved in big occlusion cases, the real difficult cases. Just approved this past 2 years with dental anesthesia. They can do like IV sedation, they can even do intubation. A lot of them, they can do their own patients and do work, or they just get contracted to different offices to put patients to sleep. There's a dental pathology, a dental radiology, a dental public health, and of course orthodontics, which is braces. And then there's also like 1 or 2 year general practice residencies. Some are hospital based. Those are for if some people want more experiences or looking for different types of experiences. Those are great programs. And there's also a lot of like 1 year, 2 year, like different fellowships, like an implant fellowship or to get more advanced skills, but it's not an actual specialty. And then of course, the great thing about dentistry, if you've been in school for a long time and you want a break, you can just go right into practice like I did. Because I was, with graduate school, I was in school, I calculated like 24 years. Like, oh my God, that's a long time to be in school. So I was ready for a little break. And what's also interesting, dental schools, dental specialties, a lot of them require you to actually work for a few years before you go into the specialty. So whereas like, I know like medicine, you can't really do anything till you go do a residency. But I know like endodontics, they don't want to be teaching you anesthesia, patient management, and everything. They want you to work at least 2 years, most of the programs, 1-2 years, or do a general practice residency before they'll even accept you to the program. So it's something you can always go back to. A lot of my faculty actually, 2 of the prosthodontists, they were general dentists for like 5-10 years before they kind of got bored. Not bored, that's the wrong term. They decided they wanted to do something different. So they went and did the prosthodontics, and some went back and did pediatrics there. So there's a lot of options later on if you find something that you really enjoy. So it takes me, so the great thing about dentistry, specifically general practice that I've been doing for the past 3 years, is that you can do as much or as little as you're comfortable with or enjoy doing. So for example, I do root canals. I do root canals on premolars and front teeth. Anything that involves molars, I send out to the endodontist. I know how to do them. I've done them before, but they're a pain in the neck. I have big fingers. It's really hard to get the files back there, and I just don't like doing them. So you can just send them out. Same thing with oral surgery. I do a lot of extractions. I send out wisdom teeth. I just don't like working all the way back there. But if there's a patient that's medically complicated, or there's a patient that, you can tell they're going to be a pain in the neck, I refer them to the oral surgeon. I had an instructor tell me, once you do a procedure, you're married to that patient. So if there's patients that you don't necessarily want to be married to, it's okay to send them out to specialists. That's why they're there. So each day, week has a lot of variety. That's another reason I like general practice, is that every day I do fillings, I do dentures, complete dentures, partial dentures, implants, crowns or extractions, sometimes just new patient exams or problem-focused exams if a patient's in pain, do implants, root canals. It's a good variety. It just keeps you on your feet. And honestly, from my experience from dental school, there wasn't anything I liked enough to do all day, every day. Like I still see kids. I've seen 1-year-old, 2-year-olds. I think this youngest filling I did was 3, if I remember. But I do kids. I use nitrous oxide. And if I have a problem, if there's a behavior problem with the kid, that's why they have the pediatric dentists that have other advanced techniques that they can use. So during my week, so the way the scheduling works, I have my columns for procedures to do those fillings. And then there's also the hygiene column. So the hygienists that are doing the cleanings, those patients get x-rays and they need exams also. So learning the time management is really important. So sometimes I'll get a patient numb and then I'll run into the hygienist room and do the hygiene check. So check those patients for cavities, see if they have any issues, check their x-rays. But that's a big time management skill that's not taught in dental school, because you're not running a hygienist also. So I could have any hour, I could be working on 1 or 2 patients and then have 3 hygiene patients that I need to check before they leave. So a big adjustment from graduating. Really the big thing is when you first start out over schedule yourself, meaning the length of time. So I scheduled like 3 hours for a crown when I first started and 2 hours for fillings, because you don't want to run behind. And then if you run behind, that's also when you start to hurry and rush, and then nothing good can come from that. So it's better to work your way up, work your speed up like that. Let's see, so you have the hygiene checks. So something else, so then during the week you have to do notes on everybody. So we have electronic records. It can be really hard to keep up with, because again, if you're running between people and you start running, a patient shows up 5-10 minutes late, then you're 5-10 minutes late, and then it just snowballs. So staying on top of notes is a big thing. Normally I end up doing 1 to 2 insurance appeals a week. That's something not taught in school. Insurance, crowns, bridges, implants, those are the big ones that'll get denied. Sometimes I think they just deny it to see if you're going to follow through with it. So you end up typing those up. They're not too much of a pain. It's just kind of an annoying thing you do. So then additionally, in school, you're not taught about the insurance games, I'll call it, what keywords, what buzzwords you have to use in your notes to get something approved, what they're looking for. And in fact, it's tough. There's an insurance company, a big one that our group uses, that all of a sudden decided they needed an x-ray or a picture of a buildup before they pay for it. So when you do a crown, sometimes you have to do a buildup to give a tooth more bulk. And so you do a buildup, then you put a crown on it. But these denials started coming in, and once the crown's on, you're not going to take the crown off. You can't take a picture, and it won't show up in the x-ray. So it's like they just started doing this. So now we know every patient, we just take pictures. There's intraoral cameras that look like wands that we do on every patient. Take a lot of pictures. So that's just kind of something you just have to deal with, the insurance, taking the pictures. So additionally, other things that aren't covered is so we talked about the business aspect, learning about the insurances. There's also the interpersonal aspect of dentistry. You have to be not only a good dentist, but you have to be a good communicator in order to explain why procedures are necessary. That's one of the hardest things. Patients are like, I'm not in pain. Why do I need that filling, or why do I need that crown? You have to be able to explain things in layman's terms to really get the patient to understand and get them on the same page as you in terms of treatment. So that's something that just comes with practice. And you also have to be able to read people. Some patients want to know every little thing you're doing. Some patients just don't want to know anything. Just do what you have to do. It's kind of just figuring out what works for each patient. Sorry, I think I skipped something. Oh yeah. So sorry, I wanted to go back to dental school. So when you work in the lab, oh yeah, there it is. Okay, so we talked about the specialties. So something that was a big challenge in dental school was the lab classes. So between going to WashU undergrad and then going to grad school, I knew how to take exams and I knew I could do really well. I could cram for any test and be fine. But when you're taking those lab classes, those can be really frustrating because you can't cram for a skills exam, for a hand skills exam. I mean, I studied the book and know exactly what the ideal form was, but getting the hand skills to do it. So that was frustrating. That was an adjustment period. And so big thing of advice is that everybody progresses at their own pace and you all get there. I mean, it's challenging. You're using a new drill and don't forget you're using a mirror. So you're working upside down and backwards, looking in that mirror. So that's kind of get your brain used to that. That was an adjustment period. The big advice is just practice as much as they'll let you. Take as many of those plastic teeth, those typodont teeth as they'll give you, and just drill. That's really, that's how you'll get there. But I know that was kind of frustrating. I didn't feel like I was picking it up as fast, but everybody gets there and you just pick it up at your own pace. And also, some classmates have parents that are dentists and they've been drilling on the typodont teeth, so none of that was new for them. Whereas I thought about dentistry. Dentistry was on my radar for like a month before I applied. So I didn't even know the difference between like a hygienist and an assistant for a while when I applied. So that was the other thing with the drilling, just because of my nature. I tried to be too perfect, too OCD, get everything just right. And if you do that, you end up making it kind of worse, because the more times you go do a pass or go over something, more chance for something to go wrong. So you don't need to be like, it doesn't have to be perfect when you're working on those plastic teeth. Just something I picked up. The other thing is, if I'm left-handed, and if any of you are left-handed, dentistry, it's actually kind of a big deal, because if you're left-handed, you sit on the complete opposite side as somebody who's right-handed. So like in the clinic, in the lab, at school, they treat us like lepers. All the left-handed people are on the edge of the aisle on one side of the room, just because everything's backwards. So most of your instructors are going to be right-handed when they try to show you something. So just keep that in mind. It's not a big deal, but it's just something to keep in mind. But I think we have an advantage, left-handed people, because you end up using your right hand for a lot of stuff too. So I can suture with either hand, depending what gives me the best angle. And also I hold a syringe when I inject patients. If I can use either hand, if whatever gives me the better angle. And the other thing to be aware of if you're left-handed, when you apply for jobs, a lot of the solo practitioners, the older offices, the hand pieces are actually mounted. So some jobs I apply for can't accommodate a left-handed dentist. So I would encourage you, most of them were good about asking, like when I talk to them on the phone, but just that enough down the road. But when you start applying, just say, hey, I'm left-handed. Is that okay? Can that be accommodated at your office? Because I know I went for one interview and he was showing me the round. I was like, can that be moved? He's like, ooh, that won't work. So just something to keep in mind. Then the other advice for dental school, your third and fourth year, when you're working with patients, you want to be careful with the patients, but also don't be afraid to take on a slightly difficult case or something, because you have the backing of the faculty. If you get in any trouble, you just ask anybody for help, and that's really how you learn, is with those cases. Ask a lot of questions. A lot of your adjunct faculty are going to be older and retired or close to retiring, and so they have a ton of experience, a lot of tidbits that I still use that I use in my practice. So a lot of times, if I had a case I was working up, I get opinions from multiple faculty members just to see, because there's a lot of different ways to approach things. And then the other advice, I found myself, make sure you try all the supplies, all the different options they give you in dental school, because I found myself getting in a routine like, oh, this works for me, and I kept using it. But in hindsight, I wish I tried some other things also, just to get exposure to it. Because in the real world, you're not going to have the whole menu of every type of supply, every type of polisher, every type of finisher, whatever, to choose from. So that's really the time to get that experience. You can get samples and things later on, but dental school, kind of wish I did that. Okay. Let's see. So went over my week. So a good thing, I'm in a group practice, so we do have call. We rotate call. We take it one month at a time. And generally when I'm on call, I get maybe 3 to 5 calls during the month, on the weekend or in the evening. Somebody in pain, we call in antibiotics. I've only had to go into the office 2 times in the 3 years that I've worked on like a Saturday. Somebody's crown came off and she was traveling for work to give a lecture. So I went and put her crown back on. But again, it's a real good lifestyle, dentistry. So dentistry is really rewarding. I'm sure you hear, like, you help people. Yeah, that is true. You help people, but sometimes you get like immediate satisfaction too. You have patients come in pain, you get them numb, you take their tooth out, and then they just feel so much better. They're a little sore, but they don't have that sharp pain again, and you just made somebody's weekend. You know, you can really have a big effect if you take out their tooth, or if you do a root canal on them right away, they'll love you, and it just feels good to see them. The first visit, they come in all swollen and just upset, and then you see them for follow-up, and it's just completely different. Even just giving somebody antibiotics for a couple till you can see them, they'll just come back and be very different. And not just in terms of pain, but dealing with teeth, you're changing somebody's smile, which is really a big deal. I mean, teeth are the way, when you look at somebody, one of the first things you see are their teeth. So you have the ability to change that. So one case that I love, she was in her 30s, and she had childhood trauma to her two front teeth when she was younger, and they were discolored, misshapen, and everything. And the first visit, she came and saw me. She said, "I've been saving up. I have money. Let's fix these two teeth." And she knew specifically what she wanted. She's like, "I want this space closed. I want this height." She knew specific. So these are exciting cases, but these cases are also scary as hell, especially the younger people that have very specific ideas. So there's ways to work them up where first you have the lab wax up the tooth. So you can wax up and give them a sample of what it might look like. And then you can take it from there, what changes you want, and there's a lot of fun things you can do. So I worked up her case, and then I remember that final visit when she came and I put the crowns on. I gave her the mirror, and when she tried on the crowns, before I even cemented it, she just started crying because this has been on her mind for so long, and she's been waiting to do it, and that's exactly what she wanted. And now they look beautiful. You can't even tell they're crowns. The materials we have now are fantastic. Those are really fun cases. We can really make a difference. Or somebody that hasn't had teeth and you make them a partial or you make them a denture. Those cases are really neat just to hear, like, hey, like I had steak the other day, or I don't know, just something as minor as that. It's really rewarding in that sense. There are challenges in dentistry. Dentistry is expensive. So we have these great materials, but they're not cheap. Impression material, filling material, lab charges. So dentistry is expensive in terms of overhead, and you have a lot of staff as well. But there's a lot of different practice models. We don't have time to go over, but in terms of private practice to help kind of mitigate that as well. But insurance, then from the patient aspect, dentistry is expensive because dental insurance, which you'll find out, is not like medical insurance. A lot of them are capped at $1,000 or $1,500, or they only cover certain things. So dentistry can be very expensive, and that creates a lot of dilemmas with patients because you can't do the ideal treatment process, the treatment planning. You sometimes have to go against that, and you have to kind of figure out what works for the patient. Sometimes tough decisions are needed when you're talking about limited funds, just because dentistry is very expensive. Something else that's a newer challenge, you might have heard in the news, something called COVID-19. The coronavirus dentistry has been at high risk because of the aerosols we create when we work on the patient. So we've been getting almost sometimes daily updates from the ADA and the Missouri Dental Association and the St. Louis Dental Association. We're getting emails from everyone, and the CDC on different protocols. And they're settling down a little bit, but they were changing there for a while. But now it's safe to work. We have to use the special N95 mask or the KN95s. We have to use a face shield. There's a lot more extra steps that are necessary. But the CDC just changed. We don't have to wait 15 minutes before cleaning the room for the aerosols to settle. They're based on science, based on the research and the viral load of things. They're figuring out what protocols are necessary. So I don't know if these protocols are for the long term or the short term, but that is a new challenge. So there is increased cost for the different masks and the PPE we need. Some dentists were charging like $5 or $10 fee to patients, but luckily the ADA has been lobbying hard with the insurance companies. A lot of these costs now, insurance companies are now giving us an extra $5, $10 per patient for a PPE fee to help us mitigate those changes. So there are some misconceptions about dentistry. The big one I want to talk about is dentistry is drill and fill. That's what dentists do. We drill a hole and fill it on up. But people don't realize, like, that's what I thought before I applied and shadowed. But there's a lot more that goes into it. Even just we can just talk about a filling. There's a whole thought process that goes into it. No fillings are the same. No cavities are the same. Nothing is ever going to be the ideal form. So you need to decide, is a filling going to be adequate? Is there enough structure for that? Do you need to do a crown? Is there enough structure to put the crown? Where to put the margin? What material to use? There's a lot more thought that goes into each filling. Do you extend the filling? Is it the tooth weakened? If I don't extend it, there's a lot that goes into it. Kind of a corny phrase from somebody in dental school, one of my instructors, but the old movie, Forrest Gump, life is like a box of chocolates. You never know what you're going to get. it's kind of like each cavity is like a box of chocolates. You don't know what you're going to get till you get inside. Because again, we have x-rays, but x-rays are two-dimensional pictures of three-dimensional structures. So many times you get in there and you're just surprised the cavity just explodes on you, or the tooth isn't even restorable. It's just not what you thought. Or sometimes if it's deep, you have to decide, can I need a root canal? Can I just put in a liner and a base? Do I need a liner? Do I need a base? There's a lot more. It's not just drill and fill. Dentistry is a lot more than that. So then questions to ask yourselves if dentistry is a fit for you. Do you like working with your hands? Because you're going to be doing that every day. Going to be holding that handpiece in that mirror. And so make sure you, another thing, be prepared. This is kind of obvious, but the mouth is a gross place. So be prepared for gross things, and especially when you start doing extraction, it gets pretty gory in there. Just kind of mentally prepare yourself for that. Big thing is just talking to dentists, talking to different specialists about what they do. I'd encourage you to shadow. I'd invite you all to shadow, but unfortunately in my office, we're limiting who's allowed in there right now during office hours. But if you wanted to email with questions, or we could meet at the office, I can show you some of my models or cases I've done, and we could talk about some more stuff about dentistry. I'd be happy to. My email is just my name, Adam, then Bree @gmail.com. Feel free to ask me any questions. And that is all I have. Oh, one little side note. The difference, I get asked this all the time, the difference between DMD and DDS. So it used to be doctor of dental surgery. Back in the day, dentists were just drill and fill. But then there was a push, I think Penn or Harvard, one of the Ivies, then decided to do a DMD, doctor of dental medicine, and decided to incorporate the curriculum with the med school and make it more like a medical thought process. So that's when the DMD degree came. But now there's no difference. The curriculums are all the same. There's some variations. Some of the schools actually have you take the systems classes with the med students, but DMD, DDS, it's all the same curriculum now. So just a little tidbit there, but that's all I got. So if there's any questions, we can talk about them.
How did you choose to go to the school in Missouri?
Yeah. So my basically my now wife, she lived here in St. Louis, so I knew I wanted to stay close. Sorry. So Missouri, there's only the two schools, the one in Kansas City, and then my school, which was new at the time, the Missouri School of Dentistry and Oral Health. My school had the 2 years in Kirksville, then 2 years in St. Louis, so I was able to live at home, live here. So that was the big thing. And also, my school had cool rotations. Half your time spent rotating at clinics around the state. We got a lot more experiences, a lot more exposure at those places because you had a dedicated assistant. Because normally at your school, you don't have an assistant, you're working by yourself. But at my rotation sites, I had an assistant, which helped a lot.
Do you see a lot of growth in the industry? So I know I was shadowing a dentist last week, and we actually were able to make a crown like right there and then, and like he like 3D printed it in the back of his office, and it was such a cool process to see. Like, do you think that method will expand like, across the country and go even further in the future?
Yeah, so the dental technologies are fantastic. There's a lot of, that's another cool thing I didn't even bring up about dentistry. It's just the technology. So now lasers are very common. So you use the dental laser for a lot of neat things. And in terms of the technology, so those crowns, when they first started, the CAD/CAM crowns, they weren't strong enough. They weren't strong enough for the back, and it didn't quite look good in the front. They're constantly coming off. But the materials have gotten better. So now you can get a zirconia attachment, which is a stronger material.
Exactly.
But they're still, so they are becoming more common. But the ones in the office, you still need to have somebody dedicated to work the oven and kind of get the color right. You don't just, at least not yet, you don't just print them. You have to still do some finishing steps to make them look pretty. But that's definitely expanding. The bigger thing that's expanding is the use of scanners. Instead of taking impressions, is to use the scanner, which takes the pictures, and then you email that to the lab, and then the lab makes the crown. So that cuts down on 2 days for the lab to pick up the model and to deliver the crown. So the scanner use is the big one that's really exploding and changing.
Cool. Awesome. Thank you.
Yeah.
Any other questions?
How did you choose to work where you're working now?
Yeah, good question. So everybody's going to be different coming out of school. I didn't want to be in an office by myself. I wanted to make sure I had other people around because I knew I'd have questions to bounce ideas off of. So it was important to me to be in a group practice that had many people. So mine's a bigger office that has 4 dentists. And then the other thing, dental school is expensive. It's more expensive than medical school. I wasn't ready to, I don't want to buy my practice. Not ready to do that yet. So I joined a Premier Dental Partners is actually a DSO, dental service organization, or like corporate dentistry. So basically I'm just an employee. I'm not worried about overhead. I'm included on interviews and hiring, and we have meetings and things, but I didn't want to have to worry about running a business yet because I wasn't ready. I didn't know enough about it. So that's why I chose this avenue. So I'm in business meetings and I'm learning about it, but it's not a concern of mine where I work. And then this is kind of like my residency, I call it, just because I had 3 other doctors to talk to about cases that they have. The most experienced one's been there 10 years. So we talked about cases, and even in the beginning, I'd bring them into the room and say, hey, can you look at this tooth? And what do you think about this? Just to get more opinions. So that's how I chose it. That's what worked for me.
Any other questions? Any final thoughts from you, Adam?
Let's see. Just make sure you talk to dentists and just try to shadow them or go in their office. Make sure it's something you really want to do. But dentistry is a great field. You'll always be able to find a job. I had a ton of interviews, a ton of job offers for group practices, the corporate practice, the solo practitioner that wanted to kind of get a partner. There's all sorts of opportunities out there. So you'll be able to find a job and find something that works for you. So it's a great field. Constantly changing with the technologies and the materials as well. Because back the old crowns used to all be metal, then used to have metal with porcelain, and the porcelain would break off. And now we have tooth-colored crowns that are just as strong, if not stronger than metal, that you can use anywhere. So just seeing that progression, a lot of stuff to keep up on. Yeah.
Well, thank you all for attending. I hope that you found it helpful. And thank you so much, Adam, for speaking to us today.
Yes, thanks everyone. Feel free to reach out if you have any questions.
All right. Bye, everyone.
Yeah, bye. Thanks, April.
Thank you.